If you or someone you know has type 2 diabetes, you're aware that it mainly has to do with your endocrine system. That's why it's so odd that among the many potential side effects of developing this condition, one of the most common is dry, cracked feet. In this video, we'll talk about what causes this condition and why it's so important that you address it in its early stages. Finally, we'll discuss 5 ways you can treat it at home so you can experience some well-deserved relief, including one way that's super simple and takes 0 effort. Please take a minute to like this video and subscribe to our channel. It helps us more than you know. Understanding diabetes. Before we start, it's important to discuss what diabetes is. This is because many people experience symptoms related to this disease before they know they have it. Likewise, it's entirely possible to experience diabetes-like complications and not have the condition. Put simply, diabetes is a chronic medical condition that affects how your body regulates blood sugar, also known as glucose. Glucose is a crucial energy source for your cells, but its levels in the bloodstream must also be carefully controlled. Insulin, a hormone produced by the pancreas, plays a key role in doing so. People with type 1 diabetes are born unable to produce insulin properly, so their treatments often begin very early. However, type 2 diabetes is an acquired condition. It happens when either your body becomes resistant to insulin or your pancreas loses the ability to produce it. Risk factors include being over 45, overweight, and lacking physical exercise. This puts many older people at significant risk. How diabetes affects your feet. There are stages to both diabetes and its various side effects and related conditions. That is, you may start to notice problems related to diabetes before you're diagnosed. Common examples include high blood pressure, vision problems, numbness and muscle weakness, or kidney damage. But surprisingly, some of the most common issues are centered around the feet. Though this seems odd at first, it actually makes a lot of sense. Raised blood glucose leads to poor circulation, which can cut off the supply of blood and nutrients to your lower extremities. At the same time, diabetes can damage your nerves, leading to a condition known as diabetic neuropathy. This starts with a loss of feeling, but eventually progresses to ulcers, sores, and infections. Early stage dry feet from diabetes. The number one thing to remember about chronic conditions is that time is always a factor. Just like diabetes itself, catching and treating the side effects associated with diabetes early can change the overall prognosis significantly. When it comes to so-called diabetic feet, the most common thing to look for is dry, flaky skin. As the feet begin to lose blood flow, other conditions may start to crop up. For instance, athlete's foot and other microorganisms may take advantage of the cracked areas, resulting in frequent bouts of infections. This is often followed by blisters or ulcers that don't seem to heal. Once you reach this point, you need to take serious steps to prevent serious infections, which can sometimes get so bad they result in amputation. Treating diabetes foot. It's important to note that severe complications such as those leading to amputation are rare. However, it's worth mentioning because it shows just how risky it can be to ignore those early stage dry feet symptoms. Whether you think you have diabetes or not, fortunately, there are a few things you can do to treat and prevent diabetes foot while at home. Here are 5 of the most important. Number 1. Increase blood flow. Since one of the primary causes of diabetic foot problems is lack of proper blood flow, one of the best things you can do is try to increase the flow of blood to that area. This can be tough for older folks, especially those who are in a wheelchair or bedridden. But if you're still young enough to enjoy some mobility, try to exercise around 30 minutes a day. Other options include doing simple foot exercises and stretches, massaging the area, or elevating your feet. Number 2. Avoid being barefoot. The reason why diabetic foot is so problematic isn't because of the dry skin itself, but the fungus and bacteria that can enter as a result. So, if your heels and feet are chapped, it's important to keep your feet covered as often as possible. You should always wear socks, shoes, or slippers to avoid areas that might be sources of mold or bacteria. Number 3. Keep your feet clean. The other major line of defense against serious foot issues is properly cleaning your feet. This means washing them daily in warm water and drying them thoroughly afterwards. Make sure you're using a gentle cleaner and avoid harsh scrubbing, as this could create an entry point for infection. Number 4. Get good compression. This is an extremely simple and effortless way to help aid diabetic foot. Remember that diabetic foot issues are a result of both poor blood flow and nerve damage, which is why compression socks are so effective. By putting constant gentle pressure on the area, these socks can improve circulation, provide stability, and protect the skin. Our number 1 choice for the best compression product is these One Compress bamboo foot sleeves. Not only are they extremely soft and supportive, but they're so comfortable you can sleep with them. So, you can let your foot recover while sleeping. How neat is that? Overall, One Compress bamboo is our top choice when it comes to compression therapy. Number 5. Moisture and protect. It's important to moisturize the dry skin in your foot to keep the condition from spreading. Still, how you do this and what sorts of moisturizer you use can drastically affect your results. Most doctors recommend pure petroleum jelly or some other gentle, natural cleaner without any harsh ingredients. Where in doubt, just ask a professional. In the end, it's always a good idea to consult your doctor if you even suspect that you might have type 2 diabetes. However, it's also crucial that you treat any foot-related problems before, during, and after your diagnosis. These tips are just some of the most important ways you can protect your feet and keep your condition from going from bad to worse. If you're interested in using One Compress bamboo to help aid your diabetic foot, check out the link in the description or go to www.onecompress.com for the latest products.